My name is Grete Farmo. I'm the Executive Director of UNOPS, the UN Procurement, Infrastructure and Project Management Specialists. And I'm here to tell you we have a problem. For centuries, our infrastructure has been made by men, for men. Streets, schools, hospitals, and our cities, they have been designed and built with men in mind. And this has hindered women from achieving their full potential. In many parts of the world, dark, unlit roads and inadequate sanitation facilities mean that women miss out on work or education. Unsafe public transport, where sexual harassment and violence can happen frequently, stop girls from achieving their dreams. Hospitals, built without reliable electricity supply, and therefore unsafe maternity wards, result in many tragic and preventable deaths. Unequal infrastructure hits women in the developed world too. I'm from Norway, a country considered to be one of the most gender equal in the world. Well, back in the 90s, I used to be a minister in the Norwegian government, and I remember how women used to have to queue up to use the toilets at the parliament between sessions. In theatres, concerts, conferences, it was the same story. Women had to wait to use the toilet, while men popped in and out and still had good time for refreshments. Inadequate toilets continued to be a daily reminder that the fight for gender equality is far from over. By one estimate, the most common current bathroom design means that women wait an average of 6 minutes to go, while men wait just 11 seconds. From unlit roads to unfit loos, when infrastructure does not consider the need of all users, including women, it can create and perpetuate inequalities. Over the past year, COVID-19 has exacerbated these inequalities. Women have been hit particularly hard for a number of reasons, from the pandemic's economic toll on women, which has pushed more women to extreme poverty than men, to women's limited access to sexual and reproductive rights, and the significant rise in gender-based violence. Again, poor infrastructure such as lack of electricity, water, and sanitation services has made a bad situation even worse. It has worsened women's time poverty by adding to women's already disproportionate share of unpaid housework. Digital technology has helped ensure some continuity during the pandemic, yet the gender digital gap means women have less access to education, health, or financial services. Combined with gender norms and restrictions, poor infrastructure can deepen inequalities and leave women and girls more vulnerable. For example, when a household has no access to water on the premises, women and girls are 80% more likely to be tasked with fetching water from a shared water source. This makes physical distancing a challenge. It also exposes them to infection. But the impact of gender-blind design impacts developed countries too. Consider this. Around the world, women constitute 70% of all frontline healthcare staff. This alone exposes them to huge risks from the pandemic. And yet, earlier last year, it emerged that a lot of the personal protective equipment given to women was failing to protect them because they did not fit. Why? Because they were designed for the male body. And as shocking as this is, it fits in with a pattern of the space and objects around us being designed around male standards. For example, women are more likely to be injured and die in car crashes because car safety tests are designed for the default male, and because manufacturers use male crash test dummies to develop car safety features. Medical research has also tended to exclude women. They were considered expensive and untrustworthy test subjects due to, and now I quote, fluctuating hormone levels, unquote. I could go on, but you get the idea. Lack of data enhances the risks of decisions that are not inclusive and appropriate. Failing to consider the needs of users may lead to inequality and injustice. We need to call out this injustice. We need to put gender equality at the center of all our work. We need the active participation of women in all aspects of decision making. The pandemic has reminded us yet again of the power of female leadership. Women leaders have handled the crisis with clarity, compassion, and inclusiveness. Despite this success, there are too few women in key decision-making roles. In 2020, only 1 in 4 parliamentarians around the world are women. 1 of 5 ministers are women. The message here is simple. Involve women and you have more representative and fair decisions. Leave them out and you have decisions that risk failing half of the world's population. To build infrastructure that serves us all, women need to be involved at all levels, in all aspects of infrastructure projects, from planning to policy to delivery and management. Only then can we ensure inclusive design which reflects the need of all users, including women, girls, and other disadvantaged groups. To build a better future for all, we need everyone represented at the table, not just half of the world. Thank you.